Hi, I'm Hein Wang. Today I will talk about serious maternal mortality in Afghanistan. Maternal mortality is a serious global public health problem, especially in Afghanistan. Women do not receive enough medical care, which affects family and social stability. This was a global tragedy. Afghanistan maternal mortality rate in 2020 was 620 maternal deaths per 100,000 live births. The leading cause of maternal deaths are mismanagement of pregnancy, childbirth, or deaths with 42 days of given birth. Maternal mortality is predicted to decline below 70 per 100,000 live births by 2023 to meet SDG 3.1. Women of childbearing age is underdeveloped section of the country may be affected due to poverty and a bad healthcare environment. It has a significant influence in low-income families, where women typically play a central role. Governments and non-governmental organizations can contribute to the improvement of the situation by providing proper education and access to cheap healthcare. Governments must establish policy aims at enhancing maternity healthcare. This report includes data on maternal fatalities in Afghanistan, Chad, Nigeria, and Cameroon from 2000 and 2020. Over 20 years period, we can see how the maternal mortality rate in Afghanistan has changed, and the comparison with four other nations can help us evaluate Afghanistan's position in an international context. In the chart, we can see a decline of maternal deaths in Afghanistan during the period, but it's still high. Maternal mortality in Afghanistan has decreased only in urban areas, while it remains high in rural areas with a higher proportion of illiterate and poor inhabitants. The research of the period provides data indicates that maternal mortality in Afghanistan has decreased between 2000 and 2020. However, research shows that maternal mortality rates are decreasing in urban areas like Kabul, but rural areas such as Georgia and Badakhshan continue to have high maternal mortality rates. According to the findings, there are 713 maternal deaths for every 100,000 persons in large. This is 4 times of the amount in Kabul. Furthermore, the chart below compares maternal mortality and survival in two regions of Afghanistan during the research period to understand the differences between urban and rural locations. In Love, 76 mothers died, but just 10 in Kabul. The difference in maternal death rates between urban and rural areas of Afghanistan can be attributed to different political, economic, and educational environment, as well as significant differences in healthcare conditions. Poor healthcare service in rural locations could potentially be a crucial cause for higher rates of maternal mortality. Approximately 89% of women living in Kabul take themselves of pregnant medical treatments. All these female, almost 82% receive support from professional care. Only 28% of women living in large receive maternity care, and only 30% receive maternity care from non-professional resources. Moreover, the level of education has an impact on maternal mortality in Kabul. The education statistic shows that 40% of women and 60% of men have the ability to read and write. However, in Iran, just 8% of women and 35% of male have similar ability. During the study period, it was known that the maternal mortality rates were high in Iran. This can be attributed to the fact that women live in Afghanistan had a higher number compared to those in Kabul. In addition, Afghanistan had a mortality rate of 40%. Women have a crucial and important role in society involved. Women have different skills and ability compared to men, extending into the role of mothers and doctors. The death of a pregnant woman not only leads to the dissolution of family unit, but also causes social instability. The stakeholders of the fact include pregnant women families, Afghan government, medical associations, women's associations, World Health Organizations. We urge that government and the World Health Organizations to provide medical support and allocate more resources to pregnant women in Afghanistan to ensure their safe survival during pregnancy and childbirth. It is duty of government of WHO. WHO's aim is to improve everyone's living conditions. They see the world as a community of shared destiny. Medical associations should provide medical assistance to pregnant women to ensure their survival and well-being. Women's organizations should appeal governments and other organizations to give priority to maternal health. This not only relates to personal well-being, but also has an impact on the stability and prosperity of the society. Thank you for listening.